a really fascinating thing happened at one of the Lyme Disease Foundation's conferences in 2000 or 2001. They had held a diagnosis roundtable with Sam Donta, Nick Harris from agonists, Steve Schutzer from New Jersey Medical and Dental School, I think. He worked sometimes with Pat Coyle on seronegative Lyme. And so Sam Donta had posed the question, could we change the diagnostics, and what would be the 2 or so primary antigens to look for? Antibodies. Be quiet. And he proposed band 23, which is OSP-C, and band 41, which is the anti-flagellar antibody, which just about everybody with Lyme has. And Yale perfected that in 1991, and then patented it in 93. Of course, everybody agreed, because OSP-C is the neuroinvasion antigen. It is a ligand for something on red blood cells. So if a spirochete has OSP-C on it, and most of them do, this is how the spirochete disseminates throughout the body. It attaches to something on red blood cells and is carried along. And as you know, it invades the lymph nodes right away, destroys the lymph node germinal centers, and then that's basically why you're screwed in the first 10 days to 2 weeks with Lyme. Forever, because it destroys the ability to mount any kind of immune response against not only just the fungal antigens shed by spirochetes, but because of cross-tolerance, where TLR2 agonists cause cross-tolerance to TLR4 agonists, or the typical lipopolysaccharide, or LPS, of bacteria, and against TLR7 and 9, which is the toll-like receptors that handle viral infections, and so forth. So basically you're screwed right away, and that's why it's so common for a Lyme victim or a chronic fatigue syndrome victim to say, yeah, I had a really bad flu and I just never got better from it. And that's the experience of most people. So Sam Donta proposes bands 23 and 41, and everybody else agrees except for Steve Schutzer. And he's the one, remember, who is the person who compiled the entries to this conference held at Cold Spring Harbor, at least prior to 1992, because that's when his book was published. It was a compilation of what everyone said during that meeting. And that was where Paul DeRay, and this is where we first found it, Paul DeRay had said that the lymphocytes in the cerebral spinal fluid of Lyme disease victims look like Epstein-Barr transformed or Epstein-Barr immortalized cells. Previous to that, in '89, he said in his own journal that these are large, immature-looking B cells or plasma cells. And that's exactly what happens when the B cell germinal centers and lymph nodes are damaged, and these B cells can't mature and become specific to whatever pathogens they're dealing with at the time. So Schutzer replied in this roundtable that, oh no, we can't narrow the disease definition right now, which is, of course, only a bad knee. You can only have, quote, Lyme disease if you have too many antibodies and enough antibodies to fight off the disease. That's a quote by Vijay Sekan during the 1998 vaccine meeting at the FDA. These people make enough antibodies to fight off the disease. These are the HLA-linked or major histocompatibility linked hypersensitivity responses, where the patients only have arthritis in a knee or a joint and no other symptoms. Quote, patients generally feel fine except for the arthritis symptoms, is what Wormser and Klemter published in 2005. So Schutzer says, oh no, we can't have fewer bands because people with chronic fatigue syndrome often have a few Lyme antibodies. So at that time, in 2000 or 2001, whenever this conference was in Hartford, the Lyme Foundation, Karen Forschner and her husband Tom put on, that obviously was mysterious to us. Why wouldn't they want to diagnose chronic fatigue syndrome patients with Lyme? And that is because chronic fatigue syndrome or ME or fibromyalgia, those are all post-sepsis syndrome. So what you're dealing with is not necessarily spirochetes. The spirochetes, the persisting spirochetes, and yes, they are persistent, you can't get rid of them, are not driving the ongoing illness. First of all, post-sepsis syndrome is the reactivation of latent viruses of all kinds due to the immune system being, quote, overwhelmed by polymicrobial sepsis. you get the same result with Lyme. So what you're dealing with is reactivated dormant, quote, infections like Epstein-Barr, cytomegalovirus, and so on. So you have the initial sepsis response, and then you have all this damage from these neuroinvasive infections like spirochetes and Epstein-Barr, and of course all these herpes virus are neurotropic. So that was very revealing, and I think if anybody needed to know a single fact about Lyme, it is that the U.S. government and this cabal, the ALDF.com, most certainly knows that what you're dealing with is reactivated viral infections. Plus, since they're the authors of all the biomarkers of disease, that they know that you have all this brain and nerve degradation because they're the ones that discovered these biomarkers. Klempner discovered matrix metalloprotein at ACE, I think it was 90. Or maybe I don't even remember what it was, MMP 130 or MMP 90, I forget. And so that's a nerve and brain degrading enzyme that he found in the cerebral spinal fluid of Lyme victims. So, you know, a nerve and brain degrading enzyme is a sign of not a bad knee, which is the case definition. One of the other criminals, Lenny Siegel, found there were abnormalities in the quantitative EEG in the brain. Robert Schoen, when he was trying to promote Yale's Lyme vaccine, mentioned, oh, you know, we got to look at this biomarker of GFAP, or glial acidic fibrillary protein, found in the cerebral spinal fluid of Lyme victims. Well, that's a sign of gliosis, or the destruction of the glial cells in the brain. So in other words, you have brain destruction going on as a result of Lyme sepsis, and yet the bad guys say it's a bad knee. So Schutzer knows all this stuff. He knows about how Lyme is a chronic neurologic disease. He worked with Pat Coyle and some of the people at SUNY Stony Brook. But he revealed this one single important fact. The bad guys know Lyme causes chronic fatigue syndrome because they're all post-sepsis syndrome with reactivated viruses of all kinds. So that's why antibiotics don't work, because you're not dealing with a simple bacterial infection. So I just wanted to make a little video and do a little talk about that today.